Hello friends, I am Dr Asha Baxi and I am back again with the question answer series. And today I am going to present young budding Dr Soumil Trivedi. Dr Soumil Trivedi has keen interest in endoscopy and has been invited as speaker in many conferences including international conferences. Indeed, he is the youngest gynecologist to have been invited at AAGL for his work on morcellation in bag. So Soumil, the question to you is that should all the fibroids be morcellated in bag, or there are some criteria that you would use? Fibroids you may want to morcellate, some fibroids you may just take them out. So please guide us.
Thank you, Dr. Baxi, for asking me this very relevant question, but I must say that I am a little bit disappointed if I give my frank opinion, because it's been 6 years since this controversy arose and erupted in April 2014, and 6 years later also we still face this dilemma, and there is a big question mark as to what our practice towards morcellation should be. Now, the answer to your question according to me is very simple. Should all fibroids be morcellated in bag and should it be contained? Absolutely yes. I say this with so much of conviction because there is a lot of misconception pertaining morcellation and pertaining fibroids in general. First and foremost, until and unless we have reliable diagnostic modalities which exactly help us pinpoint whether this is a proven leiomyoma or a leiomyosarcoma, I don't think we should take any chances. Definitely markers like LDH, especially isoenzyme 3, a good MRI and color Doppler has given us some ray of hope and some guidance to identify whether this is a high-risk fibroid with more likelihood of leiomyosarcoma. But still there is a lot of gray zone wherein we can actually come to a conclusive diagnosis. Foremost, a concept that I want to clarify and make everyone understand is that any suspected or unsuspected cancer does not come based on the size of the pathology. I say this because many of the times people have a debate, this is a simple 4-5 centimeter fibroid. I am pretty sure that I can remove this fibroid without any dissemination or fragmentation and any pieces being left behind. But it is not the size of the pathology that should dictate your decision based on morcellation practices. It doesn't matter, be it a 2 centimeter fibroid, be it a 3 centimeter fibroid, be it a 10 centimeter fibroid. So cancer, especially, we all know that the uterine cancer and cervical cancer sometimes can be microscopic. Same way in leiomyosarcoma, there can be microscopic foci in a fibroid which can be missed with the naked eye. The other thing is, this debate is only and only when we talk about fibroids. For years and years together, any suspicious ovarian cyst or maybe even a dermoid, if there has been some inadvertent spillage and you have managed to contain it, do you use this yardstick, which many people debate for a fibroid, that the damage is already done? If there has been a little bit of spillage, now what's the point of putting the dermoid in a bag? I don't think so. So the same way in a myomectomy or in a big uterus having a lot of fibroids, I think people should stop using this yardstick that during injection of vasopressin, during enucleation of fibroid, parking the fibroids after enucleation, suturing the myoma bed, if there was a spillage that had to occur, it has already occurred. So what's the point of now putting it in the bag? No. The point is you contain the damage that you can. So, as far as your question goes, according to me, all fibroids, be it of any size, even a uterus, even in people who do vaginal morcellation for large uterus, any debulking maneuvers used for tissue retrieval, be it vaginally like coring, bisection, etc. Anything. I'm not saying it should be morcellated, but any debulking maneuvers used to retrieve the specimen should and 100% be contained. Sharing with you a few video clips to just elaborate the importance of in-bag morcellation, wherein if it was not done, you would have really landed up in a soup. Now this video clip, as you're seeing here, what we don't realize is that while the tissue is being morcellated, there is so much of blood which actually comes out, which if it was not contained would have just splattered here and there into the peritoneal cavity. So this blood pooling is totally invisible when you do what is called as a naked morcellation. Coming to the second case, this is a case of a degenerated fibroid, as you can see here. If you see the amount of degeneration, it is almost virtually impossible to morcellate this. In fact, we had to stop the procedure of morcellation. We had to remove the bag through the port, and we actually used a suction cannula which is used for MTP and Owens forceps to retrieve this specimen out. And the last thing that I want to share is this case, which is an absolutely iatrogenic complication which is 100% avoidable if the morcellation was done in a contained fashion. So forget leiomyosarcomas and all those things. Leiomyomatosis, peritoni, and parasitic fibroids, as you're seeing here, it is scattered around the rectum, near the liver, on the bowel. That, my dear friends, is not the uterus. It's a parasitic fibroid which derives vascularity from everywhere. So this situation is 100% avoided when the morcellation has been done contained. So answering your question, once again I emphasize, all fibroids, all uterus with fibroids should be retrieved. Not necessarily morcellation, but should be contained during the retrieval procedure and definitely morcellated in a bag. Thank you so much.